Hey, I'm Dana Vickery. I'm going to be your nurse today, and we're going to do a head-to-toe skin assessment, okay?
Okay.
First, I'm going to look at your head and your face, and I'm inspecting for color, temperature, moisture, texture, edema, any bruising or scars, any lesions or moles. And I'm going to inspect your head for symmetry. It looks good. It's in the midline position. Now I'm going to just palpate your scalp, at your hair distribution, your color, your texture, checking for any lesions, masses, or edema. Have you had any problems with noticing any new moles or any dry skin or anything? Okay. And I'm going to palpate your temporal arteries. Just tell me if those are tender. Okay. Now I'm going to feel your lymph nodes, your preocular, postocular, occipital, tonsillar, submandibular, and your submental. And I'll feel your cervical, anterior cervical, posterior cervical, and your supraclavicular. And we're going to test your cranial nerve number 5 right now. And I will ask you to clench your jaw. Okay. And open your mouth for me. Say ah. Okay. And now we're going to test cranial nerve number 7. Can you smile for me? Can you frown?
Sorry.
Okay. Can you raise your eyebrows? Okay. Now can you like make a puffer fish face? Okay. And can you pucker your lips like you're going to give me a kiss? Okay. And now we're going to check your ears. Okay. And I'm going to check your pinna for any lesions, your tragus. We'll check for a shiny gray tympanic membrane at 5 o'clock. Okay, looks good. Now I'm going to check your other ear. Check your pinna, your tragus. Looks symmetrical, no deformities. Check your tympanic membrane, and it's shiny white at 7 o'clock. Now we're going to test your cranial nerve number 8, and we're going to do the Weber test.
Okay.
And tell me if you can feel this vibration.
Yes, ma'am.
And we're going to do the Rhine test. Can you feel this vibration?
Yes, ma'am.
Can you still hear it?
Yes, ma'am.
Okay. Now we're going to inspect your eyes. I'm looking at your lashes and your brow, checking your palpebral fissure, and I'm going to look at your sclera, check for color, and it looks good. It's good and white. I don't see any kind of discharge. Have you had any trouble with your eyes or noticed any discharge?
No, ma'am.
Okay. Now we're going to test cranial nerve number 2.
Okay.
And if you can look at this chart over here and cover your left eye and read the 3rd line.
A, B, C, D.
Okay. And if you can cover your right eye and read the 3rd line.
E, F, G, G.
Okay. And we're going to check out your pupillary response to light. Okay. Now can you follow my hand?
Oh, sorry.
Okay. Now we'll check out your nose. Make sure that it's patent, midline, no kind of masses. Have you had any kind of nasal surgery or anything like that? Okay. And we'll check out your sinuses. Okay. Now I want to look at your throat and your mouth. Can you open your mouth for me and say ah? Okay. And I'm going to check for TMJ tenderness right here. Can you open your mouth for me? Got a little click in there.
Mm.
Let's see. Now I'm going to check your neck. Looking again for any kind of masses, tenderness, discoloration, dry skin. Check that your trachea is midline, and it is. I don't notice any moles. Have you had that mole there for a while?
Yes, ma'am. Since
Okay.
birth.
Okay. All right. Now I'm going to feel your thyroid gland. And can you swallow for me? Okay. And I'm going to palpate your carotid artery. Okay. And we'll go ahead and auscultate over your carotid artery, check for bruit using the bell. Okay. Alright. And I want to check the range of motion of your head. Can you bend your head down to the side, to the other side? Okay. And now can you shrug your shoulders for me? Okay, put them down. And can you push against my hands? Okay. Alright. Now I'm going to check out your chest. I'm going to check the back of your chest out first. And checking again the skin for any kind of texture changes, dry skin, moles, tenderness, masses. Have you noticed any kind of, have you had any problems with the skin on your back?
No, ma'am.
Had any new moles? I don't see any back here. Okay. And I'm going to check out your chest now. Checking for equal expansion when you breathe in. Everything looks good. Don't checking to make sure you're not using any accessory muscles when you're breathing. I want to check your tactile fremitus. Feels good. Now I'm going to have you lay back down. Well, go ahead. I need to listen to your lung sounds. I'm sorry. Go ahead and do that. We'll auscultate side to side. Can you take a deep breath for me? Okay. And now we're going to listen for something we call egophony. Can you say the word, say the letter E for me?
E.
Again?
E. 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 E.
Okay. And now we're going to do bronchophony. Can you say 1, 2, 3?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. And now I'm going to ask you to, can you whisper 1, 2, 3 for me? Okay. Now you can lay back down. We're going to look at your anterior chest, checking for symmetry, any kind of color changes, temperature, everything looks equal, no deformities. Had any problem with the skin on your chest?
No, ma'am.
Okay. Now we're going to listen to your lung sounds. Now we're going to go ahead and listen to your heart sounds as well. Aortic, pulmonic, the Erb's point, tricuspid, and the mitral. The mitral is your point of maximal impulse, and to get an accurate rate and rhythm, I'll need to listen here for 1 full minute. And now I'm going to have you stand up. We're going to listen to your heart sounds again. Apical, pulmonic, Erb's point, tricuspid, and mitral. Everything sounds good. Now I'm going to have you lay down. And all right. And I'm going to check for jugular vein distension. Everything looks good. And And I'm going to check for, listen for any bruits in your aortic, renal, and your femoral. Okay. Now we're going to, I'm going to inspect your abdomen. Same thing again as far as the skin goes. Any color changes, dryness.
No, ma'am.
Okay, it feels good temperature-wise. And this is best if you've emptied your bladder recently.
I have done it.
Okay. All right. Everything looks symmetrical. We're going to, we'll also take your bowel sounds first in all 4 quadrants. Okay. Now I'm going to percuss. Right. And now I'm going to palpate. Feel your liver and your spleen. And now I'm going to check your kidneys for any kind of tenderness at your costovertebral angle. And just tell me if you feel any pain.
No, ma'am. No, ma'am.
Okay. All right. Well, that completes our exam for today. Thank you.
Woo!